Hello, I'm Dr. Ted Grace, Director of Student Health Services, and it's my pleasure to be able to share with you not only some of the services that we offer at the Student Health Center, but some tips on staying healthy during your academic career at SIU. We're easy to find because the Student Health Center is connected to the Student Recreation Center on 2 levels. And if you forget that, it's located on East Campus across from the Tower residence halls. I like to say that we have 4 major services at the Student Health Center. The one that you might use the most often would be our medical services, which operate much like a family practice office does. But in addition, we have counseling and psychological services located separately on the 2nd floor with a private waiting room so that you can maintain confidentiality when you come in for visits. We also have a very active wellness and health promotion services area. And within the past year, we've moved disability support services into the building so that we can all work together to give you an integrated care. We also have several ancillary or specialty services. You can get your X-rays within the facility. Most laboratory tests are available. We have a full-service pharmacy and a psychiatrist on staff at Student Health. We have a full-service pharmacy at the Student Health Center. They offer both prescription and over-the-counter medications. While they do not accept all insurance plans, they do accept the United Healthcare Student Health Insurance Plan. About 1/3 of our students are enrolled in that plan. We encourage them to get their prescriptions filled at our pharmacy. There's a $15 generic fee. There's $40 for preferred or non-preferred brands. But there's a little benefit. If you have what's called the non-preferred brands outside of the Student Health Center, it costs $75, where at the Student Health Center it's $40, so there's a slight savings there. We carry many generics, and so we always tell people to stop by and price their prescriptions on the way out of the health center. For example, some antibiotics may only cost $10, whereas your copay for that at a pharmacy would be $20, so we would advise you to just get the generic brand. Our head team physician works full-time at the Student Health Center, Dr. John Humphrey, and then we have 2 orthopedic surgeons that also make up the team of Saluki athletic physicians that take care of our full sports program. A lot of students will travel abroad during their academic careers. I myself have accompanied students on 3 occasions to Kenya. When you go to a country that requires a lot of immunizations and some preventive medications, for Kenya, you usually have to take anti-malarial medications. It can be complicated. And so if you come to the travel and immunization clinic, you can get full instructions on what you need to know and what you need to do to prepare for travel abroad. In addition, a lot of students get their allergy shots at the Student Health Center. While we don't have an allergist, your allergist would mail us your allergens. We keep those for you on site and administer them as directed by your individual allergist. We also have some community partners that work within Student Health Services. They are not part of the Student Health Center, so their services aren't included in the health fee. However, they usually maintain pretty economical charges for the students in the vicinity, and this enables students to really have the care without having to go a long way. It's very convenient for students. The first one that we have is Marion Eye Center. They accept most insurances and will provide any of the top brand frames or contact lenses. And they do a basic eye exam for our students starting at $69. The whole community uses this eye center, but students are encouraged because of its convenience. In addition, we have a branch of OISI, which is the Orthopedic Institute of Southern Illinois, at the Student Health Center. This is an active physical therapy group. Once again, they see people from the community, but they also see campus constituents, and all students are encouraged to use this. This is the group that also takes care of Saluki Athletics, and it's conveniently located within our Saluki Athletic Department right across the hall. We also like to remind students that if they would be in an accident or have some kind of illness when they're at home and they want to get back to school faster, they can often transfer the orders to the OISI and continue the physical therapy while they're at school. Our hours of operation for the Student Health Center are 8 to 4:30, Monday through Friday. We like to tell patients there's 3 ways they can make appointments. They can walk in, but we would encourage you to do that before 10 o'clock in the morning if you want to be seen that day. Otherwise, we will start to fill all of our appointment slots. You also are welcome to call 453-3311 and make an appointment, but the far majority of students like to go online through the Saluki Health Portal and make their online appointments. We get asked a lot about after-hours care. We understand that while we hope you will come into the health center when we're available, it certainly will be your most economical care in the Carbondale community. Sometimes things come up in the evenings and weekends, such as a urinary tract infection where you're just too uncomfortable to wait. So we keep posted 2 alternatives on both the doors, if you were to come up the door and find it locked, and on the website. We recommend, if you're on the east side of campus, the closest is Shawnee Same Day Healthcare. That's at 400 South Lewis Lane, and they maintain evening and weekend hours. Students on the west side of campus, though, usually utilize the urgent care part of the emergency room at Memorial Hospital of Carbondale, and that remains open 24/7. I would like to explain that there are 2 campus health fees. The first one is a student health fee, and we receive $18.25 per credit hour. This is a non-refundable fee paid by all students taking on-campus courses. It covers most services that we deliver within the walls of the Student Health Center, including oftentimes lab and x-ray and some supplies. We do have a $10 door fee. I like to think of this as a copay. You're used to paying a copay when you go to doctors in the community, and when you come here, there's $10 per visit. The second fee is a student insurance fee. When you take it spring semester, it covers you through the summer or through summer semester. This insurance is good even while you're at home or even when you're traveling abroad. It's worldwide insurance. But think of it as covering health care outside the walls of the Student Health Service. So if you need an ambulance, if you need to be hospitalized, if you need to see a specialist, that's when your student health insurance kicks in. It's a fully ACA compliant plan. And if you say, well, I already have insurance through my parents or through my employer, you can get this insurance fee refunded to you as long as you do it by the deadline. The online waiver system for students to opt out must be done every fall semester. When you do it in the fall, it carries over through the spring, so you only have to really do it once a year. The window to opt out or to show that you have evidence or proof of other insurance, that window opens 6 weeks before classes begin. And the deadline is the second Friday of fall and spring semesters and the first Friday of summer semester. After those deadlines, that health fee or student insurance fee is sent away to the insurance company and can't be returned. So please pay careful attention, and if you have any questions about opting out or need assistance, you can either call or come to the health center and we'd be happy to help you. The biggest myth that you will hear on this campus is that you can't use the Student Health Center because you don't have the student health insurance plan. I want you to understand that we do not accept insurance at the Student Health Center. You have already paid for your care at the Student Health Center through a student fee that I explained to you previously that's non-refundable. So all of you have prepaid care at the Student Health Center. And please don't listen to anyone that tries to persuade you otherwise. Only 1/3 of our students take the Student Health Insurance Plan, but all of our students use the Student Health Center. I'd like to share just a couple other things that I think it's good for you to know as students at SIU. First, we have mandatory vaccine requirements in the state of Illinois. That's at all the universities in Illinois. Those aren't placed on you by the university, but rather by the Illinois Department of Public Health. To go to university in this state, we require that you have 2 doses of measles, mumps, and rubella, or an MMR vaccine, after the age of 1 year. We require that you have 3 doses of tetanus and diphtheria, and the last dose must have been within the past 10 years and include pertussis. That's so-called Tdap. And finally, we require 1 dose of meningococcal conjugate vaccine, that's a meningitis vaccine, after your 16th birthday if you are under the age of 22. All 3 of these vaccines we must receive evidence of at the Student Health Center. We will accept this by email, fax, web portal. You can bring it in person, you can mail it to us, but we must receive it before the 10th day of the semester, or we will place what's called an I-hold, an immunization hold on your record, and you won't be able to register for classes, drop classes, add classes, or do a lot of normal activities on your account until you have that I-hold lifted. So please do this as one of your first activities when you get to the university. And once it's done, your first semester, it's good for your entire university career. I'd be happy to answer any questions that you have. If you want to go on to our website, that's at shc.siu.edu. We also have a SHC info line at siu.edu where you can send questions, or we maintain someone at a information desk at 453-3311.